Welcome back. Well, are you looking to enhance the appearance of your smile? Joining us is the same guy who joins us every week. We're so fortunate to have him, Dr. Richard Aguila. He's a board-certified periodontist at Jacksonville Dental Specialists. He is part of our weekly Dental Health Watch segment, and today we're talking about plastic surgery, but periodontal plastic surgery, and how do you really improve the appearance of your smile? So what is that specialty first all about, and then we'll talk about how you do that.
Okay, so as a periodontist, my specialty deals with the gums, the bone, and dental implants. So what periodontal plastic surgery is are gum surgical procedures that I perform that allows your dentist, allow patients to improve their smile. So the smile not only involves the teeth, but also involves the gums and the lips. So mine's more the framework, the gums and the lips. So we have some examples here of some anesthetic smiles that, of some patients that we've seen. So on the upper left, we have a patient with, teeth with different lengths, and she didn't like that. The upper right photo shows patients that have short, squatty teeth and is displaying excessive gum tissue. On the lower left, we have a patient that clenches their teeth, grinds their teeth, and they have a severe attrition and wear of their teeth. And on the lower right, we have a patient that's a little overzealous with the toothbrush and has, brushed some of their gums away. So periodontal plastic surgery procedures are done to help these types of conditions. And you say there are two types. There's resective and then augmentation as far as the procedures. So what is the difference between the two, and when would you do what for which? That's a great question. So resective means to take away. And we either take away gum tissue or gum tissue and bone to address the problem. And this patient, a beautiful smile, but she didn't like the fact that she was showing so much gum tissue. So we just, do a little resective procedure, removal of some gum tissue, and we have a nice result. Augmentation procedures are that last patient that I saw on the photo, and where the gum tissue has been, brushed away, or where we actually add gum tissue. We either, take gum tissue from another area in the mouth, or we use donor tissue. So sometimes we do a combination of both. One area may need, a resective procedure, and one area may need an augmentation procedure. Okay, and so what are some of the indications then for doing the resective procedures? What would lead one to then come in to see you for that? Yes, so the most common resective procedure is called crown lengthening, and there's 4 basic indications for it. The first one is just pre-restorative. You just have a lot of decay. We can't get to the good access to the decay, and we need to do that. Another one is smile enhancement. It's completely cosmetic. They don't like the discrepancy in the lengths of the teeth. Another one is a patient with excessive gingival display. They just show too much gum tissue, and they want to improve their smile that way. And then another one is they may have beautiful teeth, but unfortunately the gums around the teeth are completely unhealthy. So we help them establish, gum health, periodontal health around any of their teeth or the restorations. Oh, okay, so we have some before and afters too to show of this aesthetic crown lengthening that you have done. So talk about what you've done here. So this particular procedure, very simple case where we have a discrepancy in the central incisors. The central incisor on your right is shorter, so we just did what's called a gingivectomy, where we basically trimmed a little gum tissue. Just a simple little procedure like that, and it corrects the problem. This procedure is called a reverse vestibuloplasty. We did not touch the teeth, we did not touch the gums. Her lip translates high, so we do a procedure that doesn't allow the lip to translate as high, which would again hide some of that excessive gum tissue. This particular procedure, we did what's called aesthetic crown lengthening, where we addressed the gums and the bone, didn't touch the teeth, and we improved her smile that way. And then a lot of the procedures that myself and Dr. Naraki do, where we do a combination, where I address the framework, the gums, and then he addresses the teeth, and we come up with a nice, ideal result. And this is that patient that had severe wear on their teeth, and we addressed both the gum tissue and all the teeth, and it's a full mouth reconstruction, something that Dr. Naraki and I have kind of become known to do a lot of in Jacksonville.
So there's a lot of things that you guys do at your practice.
Absolutely.
And so if there are some things that people would like to pick your brain about, you have seminars that you will do.
We have monthly seminars. It's typically the third Wednesday of the month, and our next one is the 23rd of August. We just had one last week, and it was a full house, so the word is definitely getting out. You ask, you learn about your teeth replacement options, you learn about other services that we provide, and then from that seminar you get a complimentary consultation.
Good deal. Good to see you again, Dr. Aguila. Thanks for being here. We appreciate you as always. And thanks to Jacksonville Dental Specialists, of course, for sponsoring the segment. 904-460-4201. You can call that number to schedule a consultation. You can also visit their website to learn more, which is jacksonvilledentalspecialists.com.